More than 300,000 cases of Covid-19 have now been reported to WHO from almost every country in the world. That's heartbreaking. The pandemic is accelerating.
The coronavirus outbreak, which has been labeled by the World Health Organization as a pandemic, has forced countries to close their borders and put citizens under lockdown. Governments are under pressure to curtail the spread of the virus and also ramp up their response in tackling this global emergency. Here's all you need to know about how to fight coronavirus in this complete COVID-19 guide. Let's begin with, what is coronavirus? Coronavirus isn't the name of the pathogen that's been infecting and killing people around the world these past few months. Coronaviruses are actually a big family of viruses, and what we are dealing with right now is a new virus strain called Covid-19, which was first identified in Wuhan, Hubei province, China. How does Covid-19 spread? Covid-19 is primarily spread through respiratory droplets. That means to become infected, you generally must be within 6 feet of someone who is contagious and come into contact with these droplets. It may be possible to get Covid-19 by touching a surface or object that has the virus on it and then touching your mouth, nose, or possibly the eyes. How contagious is the coronavirus? According to the World Health Organization, the new coronavirus has an average contagion metric between 2 and 2.5. This means that if a person is infected with Covid-19, he or she can pass it on to more than 2 people. Symptoms to look out for. According to the World Health Organization, the most common symptoms of coronavirus are fever, fatigue, and dry cough. Some patients may experience aches and pains, nasal congestion, a running nose, sore throat, or diarrhea. The amount of time between infection and the onset of symptoms is estimated from 1 to 14 days. Most infected people show symptoms within 5 to 6 days. However, cases have also been reported where the infected patient is asymptomatic, that is, no displaying symptoms despite having the virus in their system. Who is more at risk? People of all ages can be infected by the new coronavirus. Older people and people with pre-existing medical conditions such as asthma, diabetes, heart disease appear to be more vulnerable to becoming severely ill with the virus. What to do if you think you've caught the virus? If you have fever, cough, or difficulty in breathing, have traveled to a nation where Covid-19 is currently spreading, or have come into contact with a person who tested positive, immediately contact your country's respective helpline numbers. If you're in India, the 24/7 helpline contact number is 011 2397 8046 or your state's helpline number, so that authorities can decide if you should be tested. Is there any cure for coronavirus? Currently, there is no cure for this coronavirus, and treatments are based on the kind of care given for influenza, seasonal flu, and other severe respiratory illnesses known as supportive care. Scientists world over are, however, working to develop a vaccine. According to the World Health Organization, if you are hospitalized for coronavirus, you may receive antibiotics to prevent any bacterial co-infection. Now, let's look at how to protect yourself. The World Health Organization recommends that we wash our hands frequently and thoroughly with soap. Cover your face with tissue or your elbow when coughing or sneezing, and then throw the tissue in a waste bin. Avoid touching your eyes, nose, and mouth. Clean surfaces and objects you touch often. Seek medical attention if you have symptoms, and avoid direct contact with live animals in affected areas. Scientists have repeatedly questioned the effectiveness of face masks in protecting a healthy person from airborne viruses, stating that they are more useful in keeping an infected person from affecting others. Why is social distancing important? The Centers for Disease Control and Prevention describe social distancing as staying away from mass gatherings and keeping a distance of 6 feet or 2 meters, about 1 body length, away from the other person. The aim of social distancing is to slow the spread of the virus, giving global health systems more time to care for patients who need help. This is being called as flattening the curve. Cancellation of public events that draw large crowds, closing down of public spaces, restricting travel are all an essential part of social distancing. But avoiding smaller gatherings is equally important. What is self-isolation and self-quarantine? Isolation and quarantine are used to protect the public by preventing exposure to infected people or to people who may be infected. Isolation is used to separate ill persons who have a communicable disease from those who are healthy. It restricts the movement of all ill persons to help stop the spread of certain diseases. Quarantine is used to separate and restrict the movement of healthy people who may have been exposed to a disease but do not show symptoms. What is a lockdown? While at least 14 days are recommended for a self-quarantine, the duration of a lockdown depends on the decision of a local government. A lockdown is an emergency protocol that prevents people from leaving a given area. A full lockdown will mean you must stay where you are and not exit or enter a building or the given area. This scenario usually allows for essential supplies, grocery stores, pharmacies, and banks to continue to serve the people. All non-essential activities remain shut for the entire period. How to prepare for a lockdown? Given the likelihood that more and more people around the world will be housebound, preparing one's home for that eventuality is an increasing concern. Among the things being stocked are non-perishable foods, basic medical supplies, cleaning and hygiene supplies, etc. The WHO has acknowledged that this crisis is causing the public to have increased levels of anxiety. It advises people who are feeling stressed to avoid reading, watching, and listening to news excessively. How to work from home effectively. If you are among the world's privileged population that can still work from home and earn a living amid the pandemic, having a fixed daily schedule like you would if you were working from office, declutter and organize your working space, preferably a separate room. Get dressed as if you are getting to work to be in a better frame of mind. Allow natural light into your workspace and do take breaks to stay focused. Also, while you work from home, don't forget to do a bit of workout from home as well. So in short, don't panic. Follow social distancing. Practice hand and respiratory hygiene to reduce risk of transmission. Keep yourself informed through trusted sources.